Hi, everyone. I'm David Williams, president of strategy consulting firm Health Business Group and host of the HealthBiz podcast, a weekly show where I interview top healthcare leaders about their lives and careers. Well, I first met Mark Clermont when he was CFO at UpToDate, and I worked with him as he helped to guide the company to massive success under the Wolters Kluwer umbrella. We did bond a few years later as we were each recovering from near fatal accidents, but that may be a story for a different type of podcast. Well, now, as the CEO of Cecelia Health, Mark is driving another growth train with massive upside. The virtual specialty medical practice is just what the doctor, health plan, and patient ordered for proactive health condition management, including in the burgeoning field of pharmaceutical-assisted weight loss. Please subscribe to the HealthBiz podcast and leave a rating or review. Mark, welcome.
Yeah, glad to be here, David. Thanks for having me on. And, certainly our near fatal endeavors there was an interesting time and a demonstration of both the effectiveness, the fantastic effectiveness of our healthcare system, and also places for improvement. And we are thankfully here today and happy to be present, accounted for, alive, and hopefully well. I at least feel good.
Oh, good. Well, you look good too, Mark. And the podcast can sometimes be a bruising experience, but I don't think it'll be anything more serious than that. So we should be all set. Well, let's roll things back as long as you're talking about history, and love to hear a little bit about your background and upbringing. Any childhood influences that have stuck with you over the course of your career.
Well, I had the good fortune to be raised partly on a naval base way out in the Aleutian chain, and my dad was head of surgery there. So kind of an interesting set of influences growing up on a bit on a naval base. Those kinds of you're surrounded mainly with young men who are there and intrigued by spending time helping my dad raise kids and my mom and dad there, and yet you're captive. And it was also during the time of the Vietnam War and kind of the repercussions there. So very influential time as we watched firsthand how he was addressing all of those situations, and so very formative. Fast forward, moved back to Massachusetts, and my dad continued his path as a general surgeon, and all the time he was one of those guys that went into medicine for all the kind of the right holistic reasons for going into medicine, and just a remarkable guy at a time when people were starting to no longer do house calls. He's the kind of guy that would do those kinds of things, and you'd see him take phone calls, go disappear for a little while, go visit the neighborhood kind of thing, and just really influential in that context. So nice to see that. He had hoped, I think, at one point that one of his 10 kids would go into medicine.
Yeah.
I wasn't that guy. I think I was maybe influenced to go on that track, but I caught the business bug pretty early on at my time at Northeastern University here in Boston, and never really looked back from that. Glad, however, to eventually have reconnected within healthcare. You mentioned the time at UpToDate, which was really my jump back into healthcare, and glad to be now able to at least use some of that background in business to make sure that we can do this and deliver the kind of care that we aspire to, and do it sustainably.
So, Mark, with 10 kids, were you the one that got the closest to being a doctor, or did anybody else actually make it more directly?
Well, none of the 10 kids actually went straight into medicine. My older brother, I'm number 2 in the chain. My older brother went on to a very long career at Joslin Diabetes Center, mostly in research and lab, and he's still enjoying his time in Cambridge, Massachusetts, in the space. Now more in the private sector, and doing some really interesting things. That's about as close as any of the children have got.
It's kind of like when you're doing it's like with horseshoes. You get a couple points anyway, or one of those games where they count the near misses. So cornhole or something like that, right?
Yeah, I think I probably had the maybe the aptitude to go into medicine that, and certainly, I think my dad's heavy hand in influencing me was present. But again, I caught the business bug,
Yeah,
and
yeah,
at a time, and what I found was that was far more intriguing to me um, and rewarding, frankly. I happen to be good at it, so they say to live the life that. If you want to be happy at work, do the thing that you love to do, and that's what I do.
yeah. Well, let's talk about Up to Date because that's sort of a fascinating company, and as you say, your first foray into healthcare, and it was you were with Up to Date before the acquisition of Walters Kluwer, and then with Walters Kluwer, had that role, but then also a broader role within there. So, what was that like? What did you learn from that experience?
Well, it was a fantastic time. I joined in August of 2006. At that point, it was founded by Bud Rose, just a phenomenal man to have a nephrologist by training to have come up with. I think to help him with his authoring effectively was the driving force for creation of Up to Date. And to come in at that time, which was really just the beginning of the explosion years for the company, and in terms of accessibility, availability across not just in the U.S. and expanding into international waters. Just a fascinating time to come in, and yet it was still a venture stage company. It was very young, and we had a lot of growing up to do. Fast forward from August of 2006, there was no rest for the weary. I was one of the first uh, outsiders to come in from a leadership standpoint, and part of my job was to build out the leadership team, kind of rebuild this thing for sustainability, and along the way, which is part of my expertise and history. Um, Figure out all the accelerating things that you need to do inside a business to make sure it's functioning in the right way, that your product set is aligned the right way, that your go-to-market strategy set the right way. Do all those things. And oh, by the way, um, the company at that point had been in the marketplace for 13 years, and the then CEO, Pete Blindahl, was considering retirement. And so it was time to also consider what was next for this company. And so that was all part and parcel to my arrival. And fast forward on October 23rd, 2008, we closed on a sale to Walters Kluwer Health, and then Walters Kluwer, to much to their credit, supported this business, saw the rocket ship that it was and still is, and the potential for what it was and is in the marketplace and its influence in medicine globally, and just let us, the leadership team, keep on going. And we rewarded them with just outstanding growth. By the time I left in 2015, we had grown. We were selling into 164 countries. And I think of it less in terms of the actual monetary side of the equation. I think of it much more in terms of the clinical impact, where 1 out of 4 patient decisions are influenced beneficially by the use of Up to Date. And you think of that dose response that a clinical decision support tool at the point of care can offer. That's a pretty remarkable thing and extremely rewarding.
Is Up to Date really an amazing company? I'd heard about it from my brother, who's a physician, and it was a time where Up to Date was coming around, and people say, a physician will never pay for anything, so that they get this, that, and the other, all sorts of things from all over the place. And the remarkable thing was, you could say, well, yeah, I mean, maybe, except here's one example which they'll routinely pay for it, and it's because it's actually is very valuable to them, and that was just such the basis. And I think you saw it sort of reflected in the financial results, because if this thing is so valuable, it's influencing patient care, it just has such a big impact. And they were able, compared with sometimes when you see a large company buy a smaller one, they didn't crush it or anything like that. It really enabled Up to Date to grow, but also then even just the rest of their clinical offerings. And I'm sure that experience that you had in seeing the impact also then, is something that you can see and recognize when you're involved in new ventures as well.
100%. And this was also a time, it doesn't feel, it's a bit, it kind of reminds me of the iPhone was what released in 2007. In a way, it kind of feels that same way with Up to Date. We were one of the very first we were a SaaS business before SaaS was
Yeah.
even a phrase. And all of the elements, whether they're financial elements, the subscription-based model, this was all groundbreaking aspects of how you bring a company to market and deliver what we do. And then you're leveraging this emerging technology of networking to make this product available in a way that hadn't been available with others before. No longer did it need to be delivered on CD or DVDs, and heck, Up to Date goes back to 1993, back when there were little 3.5-inch discs. So a long trajectory of technology, and then the whole concept of having at some point the business people started to capture, well, you want to have raving fans, and let's grade in your users, your consumers, your buyers in that context. You want to have fans, and here we were with Up to Date. We had fans uh, because we were delivering a high quality product for something that was extremely usable, very reliable, and we were very careful to not harm the relationship, the doctor to product relationship that really was the magic of Up to Date. And I'm talking about things like ensuring that we were both transparent about conflicts of interest, but also being very careful about who we took in as bedfellows as far as business growth, and not all in the name of ensuring that we had as much authenticity to what we were doing, eliminating even perceived conflicts of interest. And then, of course, as you know, that the product itself adjudicating across specialties, and then helping physicians with evidence-based medicine, even in the face of a lack of evidence. It's just something that is at the time was unheard of, and to do that in a way that we could sustainably deliver, people would pay a high price for it at the time. But if you think about it, that product started in just nephrology, and by the time I left, it was 13, 14 specialties. Never changed the price once. No price
Yeah.
increases. And I think they're up to I think the latest count is somewhere in the 17 to 23. I guess it depends on how you bifurcate the
Yeah.
subspecialties and whatnot. And just a remarkable thing without having changed the price all the way through 2015. I think since then they've done some modification to their pricing models, but really just a remarkable product, and guiding the growth of that engine in a way that we can make it sustainable and accessible to as many the right parties that we needed to get to.
So after that kind of formative experience, you had some time in leadership roles elsewhere. And then when you found your way to Cecelia Health 2 or 3 years ago, why did you go there, and kind of what was the state of the company when you arrived?
Back at Up to Date, the chief medical officer was Dr. Peter Bonus, and I remember a conversation specifically with him. It's the lament at the time that physicians had about when a patient would leave the room, the consult room, and you send them off with a prescription, a protocol, a therapy, and knowing in the back of your head that 6 months from now that patient would return, not having it adhered to therapy. And Dr. Bonus had put it in the context of it's unfortunate we're not able to actually uh, go home with the patient, so to speak,
Yeah.
in terms of helping them with therapy adherence and whatnot. And so that always stuck with me. And kind of the early this is the early days of telemedicine. Um, and at the same time, I always knew that I wanted to get closer to patient care, direct patient care. Up to Date was selling physician business to business effectively. And at the same time, having that direct patient care, maybe that harkens back to my dad's aspirations for at least one of his children. And uh, you know, for me, having you know, prior to going to Up to Date, I was in investment banking and financial services, and you're about as far removed from having an
Yeah.
impact on humanity. And contrast that with healthcare. And so once you get a bite of and a taste for what you are achieving in healthcare, and just it fills the soul. And to then have direct patient encounters, so I knew I wanted to migrate in that area, and seeing the versioning and emerging technology and capabilities of telemedicine. I wanted to start jumping into that foray. So anyway, fast forward to October of 2020, mid-pandemic. Um, I was introduced to Cecelia Health through one of my venture capital contacts, and I saw a company that was really fascinating. It was founded back in 2009 as a diabetes management company, and lots of competitors in that point health, the digital health area, and much to the founder's credit, David Weingard grew that company to past a lot of classic breakpoints for any company, let alone a digital health company, and started to hit a lot of scaling issues. And so what I found was a company that had a lot of the hallmarks of that, a founder-led company that maybe didn't have the discipline and execution chops to recognize what it could do to accelerate growth and make this product more widely available. So in looking at that, David then moved into the executive chair role. He sits where he sits today. He and I have a fantastic working relationship in that context. What I saw was a company that had grown far beyond diabetes by itself, and had built a core asset, which over the previous year or two in building out an actual medical practice, a national telemedicine specialty practice. So fast forward to today, we talk about Cecelia Health as a virtual specialty clinic, and focusing in on endocrinology, nephrology, pulmonology, and cardiovascular, all in with a predominant focus on chronic diseases. And so while we still do and engage in diabetes and endocrine needs in that regard, we are also in renal and, as I said, a number of respiratory therapies, and combine that with all of the comorbidities that are cardiovascular, metabolic related. So here we are today, a company that is, again, practicing and licensed in all 50 states and having a good time.
No, that sounds great. So, I think about telehealth, usually think about something where it's you sort of call up for a quick consult or something. I think it's more primary care. You're describing something that's, less, is more ongoing if you're dealing with chronic care. And then also you're working on the specialty side. So how did that kind of come about? It's not an easy thing to, put together. What's the need for it? And, who's it actually, a customer that's driving that?
Yeah, so yeah, I think of a few things. So I am a customer of one of these new primary care players, may or may not be owned by Amazon, let's say.
Yeah.
And that experience is I love it. I'm a zealot. I'm a raving fan of that model. You and I have talked about this. And that model it's convenient. It is, they treat me like an adult. I can go in person. I can have a virtual visit. I can have interactions through chat. It's just fantastic. And I recently had a referral to a specialist. And again, live up in Boston like you do, and referral to specialist to one of the major facilities that we enjoy in the greater Boston area, and it really felt like I was being sent back to the dark ages.
Yeah.
And I liken it to the first time I saw an HD TV. And the moment I saw that high definition, I said, you know what? I am never going to turn that low def TV back on, ever. And that's what it felt like to me. And I said, here I am. I'm running a company that's a specialty medical practice. Let's elevate what we're doing so that we're at least operating on the same plane as some of these new players. And so that's, and you'd say, well, why is it so hard? Why haven't we made this kind of progress before? And well, here we are. We seem to be the only player that's in this specialty clinic space, elevating what we're doing. And let's start operating at that same plane. So it starts there, and you then say, well, what are the benefits of all of that? And you say, okay, we're improving access. And you can look at just the foundational principles of the company. There just aren't enough endocrinologists in the country. In fact, there aren't enough you could go across the entire range of specialties, I think. There just aren't enough practitioners out there. And yet the need is there. And so telemedicine there are quite a few conditions that are very conducive to telemedicine. Not all, and there are certainly many situations where you do need to have brick and mortar, lay hands on a patient, so to speak. Um, but it's a remarkable thing that what is available through telemedicine. And so we said, well, let's just focus primarily on this telemedicine element. Let's improve access for patients across the country, and that's what we're achieving. Um, we do this really interesting thing. I often talk about healthcare in a solar system analogy. And so if you think of the sun as kind of being the core of medicine, and that's anything that's in hospital, in clinic, also telemedicine. Um, there's a code for that. It's under physician supervision. It's paid for by private and public health insurances and whatnot. Call that the sun. And then you kind of have these outward radiating rings of care, at least care in the as patients would perceive care, and that might start looking like health coaching. It might start looking like lifestyle management. And as you then play the landscape of patient access, what we've done here is deployed our clinical team across that whole continuum. And so what that means is not only can a patient see one of our endocrinologists in the core of medicine, but oftentimes patients are entering that pathway through maybe their health plan relationship. Maybe they're entering that pathway through a patient support program sponsored by a pharmaceutical company. Again, from a patient's perspective, that they still see that as care, and yet they're still able to access clinical care that's relevant for what they're looking for, and obtain that care through a Cecelia Health. But now, if they need to be navigated maybe to their local PC primary care, or do they need to be navigated to their local specialist for an in-person consult, we can do that, and we do that every day. That kind of continuum, and we've built the architecture to support all of it. It's it, it rem it's remarkable in both achieving the accessibility goals for access to specialties, and it's remarkable in achieving the patient satisfaction scoring that, of course, health plans and health systems care about. And then I care about it too, just in overall in terms of improving patient experience. And again, going back to that HD versus low def TV analogy, doing it in a way that's modern.
So, Mark, it's a very interesting way to describe it, and I think the HDTV example is a great one. Let's talk about it in the context of something that's just very front and center in healthcare right now, which is these new GLP-1 products. You mentioned
Yeah.
that you mentioned pharma, you mentioned health plans, you mentioned the physician relationship. There's a lot that's sort of converging here, and what it sounds like, if you're dealing with endocrinology or dealing with diabetes before, it sounds like you sort of have maybe the perfect laboratory to see how these things are working in the real world. Are you involved in the GLP-1 space, and what are the stakeholders looking for there? There seem to be a lot of unmet needs.
It is a fascinating area. It is growing at an incredible speed. And so, in fact, we talk about them not so much. GLP-1s are just a flavor of anti-obesity medications. So it's kind of put it more in a different class. And even then, I think that's a short-term classification for this grouping of drugs that just are remarkably efficacious for. Of course, many of these started in treatment of and management of type 2 diabetes. And so we are considered a center of excellence in diabetes. So we had been working from an R&D standpoint in supporting clinical studies for many, many years. We've been supporting patient support programs in the preceding some earlier stage drugs, liraglutides, and preceding to the semaglutides. So we have deep knowledge in understanding what these drugs are and the benefits of them. And so here we are in this remarkably changing world where just looking at obesity and weight management, the former model, and I'll say what is becoming rapidly the old model or the old view is individuals that were struggling with weight. It was a matter of willpower, and we focused consistently on diet, exercise, and willpower to try to change behaviors and lifestyles. That's still very relevant. But what these drugs are introducing and also evidencing is that there's some brain chemistry that's involved in the benefit of these drugs is to do a reset of the brain chemistry as well. And you can then use that, leverage that to augment the lifestyle and behavioral change to really positively influence somebody's trajectory as it relates not only to obesity and now with some of the results, just a couple of weeks ago, there was a Spectrum phase 2 results, I think, were released about the cardiovascular benefits of these drugs. And so really phenomenal time. At the same time, they're very expensive. And you think about just the U.S. population overall, 40% of the U.S. population has a BMI that would qualify for these drugs. That's a pretty remarkable statistic, and yet these drugs
Yeah.
cost anywhere from $1,000 a month and more. So they're very expensive. They're not widely covered by health insurance yet, although that's slowly changing. Um, and yet you have this high demand, and so what's happening is you're seeing these drugs being prescribed off-label. You're seeing these drugs becoming accessible through sources that are outside the clinic, the traditional core of medicine, and whether that's in a med spa environment and others, or in a prescription house. And that's for me, that's concerning from a patient safety standpoint. Again, these drugs have some history, but not a long history, so they're not well understood, as well understood as say a statin is, that's been around for decades. And yet they're being leveraged and deployed in scenarios here with patients with not a lot of clinical oversight, and that's concerning. And so we're a bit on a crusade here to help introduce clinical oversight to the process, make sure that these drugs are being prescribed appropriately, and maybe they don't need to be forever drugs if you combine that with the kind of lifestyle and behavioral management elements, and someone perhaps can step down or step off of the use of these drugs. We'll see. This is all a fairly new market. Again, the concern from my vantage point is from a patient safety standpoint, and then you look at employers and the commercial insurance programs. They're looking at this, and they have employees saying, "Look, you've been putting me on these particular weight programs. I've been up and down. Everybody's on
Yeah.
these programs have been up and down, and here are these drugs that can help with this process. Why won't you cover them?" And the employers again
Right.
saying, "Well, 40% of I can't afford for 40% of my population
Yeah.
to go on it." And by the way, not only is it expensive, there's also a patient safety concern, and the long-term effectiveness of these is still being studied. And so what we've done is we had already offered a program out in the marketplace to incorporate AOMs into a weight management protocol. That turned out to be very interesting to an increasing number of parties. And so whether you're a health plan, whether you're a health system, a retail health provider, or even a pharma company, these programs are interesting. And because we have the integrated medical practice, we're actually bringing the right level of clinical acuity and oversight so that patients aren't being sent home. There was a stat that Mayo Clinic had put out there, reported, I don't know, 2 months ago or so, that 5% of patients that were going on AOMs were presenting in ER with severe dehydration.
Yeah.
And because there was no clinical oversight that was going along with them, with
Right.
that. And I think in that case, they went so far as to say, hey, those drugs were accessible to those patients through a med spa environment.
It encourages you not to eat, but you got to remember to drink some water at the very least. Mark, you're being a little cagey because I know the company's been very successful. When you talk about stakeholders
Yeah.
becoming interested, are you at liberty to name any of your customers? I know you're working with some prominent names within the industry.
Yes, and I'll preface this with saying, we are one of the elements of secret sauce to Cecelia Health is we don't need our name in lights. So oftentimes we're working as the intel inside as on a white label basis. We recently struck up a relationship with CVS, and in fact, that program went live just a handful of weeks ago in weight management and working with their downstream employer and health plan customers to bring this and make this accessible to that national window. That among a number of our health plan customers, as well that are beginning to introduce this. It's January 1 of 24 is the beginning of an important benefits year, and it's a benefits year that will have significant advancement in the coverages of GLP-1s and bring that forward in the marketplace with at least some level of, it's not so much about a curb the adoption scenario, although I think the effect of this is let's make sure we look at it in terms of let's make sure that patients are getting appropriate care. And that appropriate care isn't always to rush to a GLP-1 or an anti-obesity medication. There are other therapies that are well proven that may need to be tried and tested ahead of time. However, this may be appropriate care for particular patients, and that's our job. It's the benefit of having this integrated specialty clinic that can also operate in a health and wellness environment, combining those two things to make sure that a patient at the end of the day is getting the right kind of care. And then longitudinally, again, we don't know if these can or should be forever drugs. We just know that they're very expensive. Um, and if there are opportunities for those patients who are enjoying the benefits of them, they're certainly not intended to be short-term drugs. The worst case scenario, you hear these horror stories of patients going on them 30 days prior to a wedding or some other
Yeah.
important event. And that's exactly the wrong use case for these. And we're on again a bit of a crusade to make sure that we're delivering appropriateness of care and do this on a national scale. And thankfully, CVS is also sees that, as you know, they're pivoting very strongly to becoming a healthcare delivery company. This fits very well within that construct, and we couldn't be more excited to be partnered with them in the background.
Good. Well, congratulations on that progress. I look forward to seeing and hearing more about it. I want to change a little back as we end this interview to on the more personal side. Now, you're a guy who always has some interesting ideas of mobility, and I remember you did get a nice bike, and it was great. Except when you go over the handlebars and smash your head. I think we were musing before about an e-scooter. Did you get yourself an e-scooter? What are you thinking there?
I did. I did get an e-scooter.
Yeah.
It's
How's the handlebars? Can you like go over the handlebars of that too, or is it a little bit better?
you can go over the handlebars pretty easily on those as well. You need to be careful. But I will say it's very freeing, especially in a city like Boston. Boston happens to be, as you know, it's a fantastic city. It's very accessible. It's very bike friendly, and who knew? Now it's very scooter friendly. And when you combine that with the amount of traffic and the woes of the transportation system, the rail system in Boston, which I don't know if I've never seen a ranking of the lowest of the low,
Yeah.
but Boston's transportation system is pretty low on that list. Um, Boy, getting around on an e-scooter, getting to the office on an e-scooter, you can't feel better about that. It's good fun, but
All
be
right. Well,
careful out there.
yeah. No, I hope you're listening to your own advice. I stay inside the car when I can, but you're right. It doesn't move too fast in the trains. All right. Last question, Mark. Have you had a chance to read any good books lately? Anything that you would recommend?
There was for sure. There's I think maybe two things come to mind. There's I started picking up at harkening back to Walter's Kluwer. One of the leaders at Walter's Kluwer that was instrumental in the acquisition of Up to Date back in 2008, Arvind Subramanian. He and I have stayed in touch over the years, and he had recently recommended to me. He said, I've been reading the Calendar of Wisdom. It was Tolstoy's last piece. He says, you want to check that out. And so
Yeah.
it's a fantastic work. It's you just pick it up once in the morning, and if you're not familiar with it, it's a once a day kind of thing. He has these thoughts that are organized by day, each day for a year. You just kind of set your mind to thinking about things like today's one of today's elements. The history of mankind is the movement of humanity toward greater and greater unification. And what a good thought to
Yeah.
start your day with. So that's
Yeah.
one, and I visit that every day. But I will say this is one fantastic book I'm actually rereading is called The Emerald Mile.
Hmm.
It's by Kevin Fedarko. It is this fantastic story of the fastest ride in history through the Grand Canyon. And what brought
Yeah.
me back to this is, this year was an amazing snowpack out in the West. In fact, a historic snowpack out in the West. And the last time the snowpack was this high was back in 1983, which is when this story, this Emerald Mile story, takes place, and kind of two narratives related to the melt of that snowpack. It involves the near collapse of the Glen Canyon Dam, and then these crazy river guides that rode this wooden dory down the Colorado River as
Yeah.
in this in turbulent waters. It's just a fantastic read. A lot of history in there about the Grand Canyon, about the dam, the overall infrastructure around building the dams. Um, Fantastic read, and there's a little bit of engineering mixed in there that you can then take with you as you're thinking about how to operationalize or make your own business more efficient. So everything I read kind of comes back to the making your business more efficient. What can I learn from that and
Yeah.
apply in real life? So Emerald Mile, it's a
Uh,
great book.
that sounds like two good recommendations. Well, Mark Clermont, CEO of Cecelia Health, I want to say thank you so much for joining me today on the HealthBiz podcast.
Thank you very much, David. Always a pleasure to see you.
You've been listening to the HealthBiz podcast with me, David Williams, president of Health Business Group. I conduct in-depth interviews with leaders in healthcare business and policy. If you like what you hear, go ahead and subscribe on your favorite service. While you're at it, go ahead and subscribe on your second and third favorite services as well. There's more good stuff to come, and you won't want to miss an episode. If your organization is seeking strategy consulting services in healthcare, check out our website, healthbusinessgroup.com.